but today we're going to talk about GERD, or gastroesophageal reflux disease. GERD is a common medical condition affecting about 20% of the US population, and it primarily causes two symptoms: heartburn and regurgitation, which is the feeling of gastric acid and other things coming back up into the throat. But it can also cause other symptoms outside of the esophagus. Chronic cough, voice changes, and even a sore throat can sometimes be symptoms of gastroesophageal reflux disease. The primary problem with GERD is a weakness in a particular valve that sits between the esophagus and the stomach. This valve is called the lower esophageal sphincter, or the LES. And in patients who have a weak LES, stomach contents, especially acids, can come back up from the stomach into the esophagus. Certain things in our diet and lifestyle can actually trigger reflux. First and foremost, patients that are overweight often struggle with GERD. And then a lot of the foods that we enjoy on a regular basis: caffeine, alcohol, fatty foods, even spicy foods, are known triggers. One of the biggest problems, however, with reflux is eating dinner and larger meals later in the day, closer to bedtime. This can actually cause a lot of symptoms when we're asleep at night. So when we think about the management of GERD, we want to first look at some of these diet and lifestyle factors. This forms the foundation for GERD treatment. So overweight patients are often encouraged to try to lose weight with healthy dieting, exercise. We also want to avoid certain foods later in the day. So specifically caffeine and alcohol, when consumed in moderation, that can be tolerated quite well. But if we are overdoing it, or we're doing it later in the day, that can actually trigger a lot of symptoms. When lifestyle and diet changes don't work, we have to reach to over-the-counter medications. And this can be things such as histamine receptor blockers. So medicines like Zantac and Pepcid can often work for patients with real mild symptoms. But for the most part, we're using proton pump inhibitors, or the PPIs. These are the strong acid blockers like Nexium and Prilosec, which work very well to relieve symptoms of heartburn and regurgitation. These drugs are actually best used for 2 to 4 weeks at a time to help manage symptoms. If you feel like you need these medicines long term, you want to discuss this with your physician, because there are some recent studies showing that using these medicines long term can actually have detrimental impact on bone health, as well as things like heart disease, stroke, and even chronic kidney problems. Sometimes medicines don't work, we have to look to surgical options. The traditional surgery is also known as a wrap or a fundoplication. This is an invasive procedure that actually twists the esophagus and stomach to create a barrier where that valve normally is. A new exciting surgery is called the Lynx procedure, which is actually a metallic bracelet that's placed where the valve normally is. It's a little bit more physiologic. It opens and closes when we swallow and helps to prevent reflux from happening. Now, an important point is a lot of patients will say, I've had reflux for a long time, I've done the dietary changes, I've taken medications, and I feel great. What else do I need to worry about? And the answer is Barrett's esophagus. So Barrett's esophagus is a precancerous condition in the esophagus which actually has no symptoms in and of itself. One of the main risk factors for actually acquiring this condition is actually having reflux for 10 years or more. So even if you are well controlled on, say, Zantac or Prilosec or Nexium, you actually want to discuss getting something called an upper endoscopy with your primary care physician. This is the way to screen for Barrett's esophagus. At the Center for Digestive Health, we not only screen for Barrett's, but if it's found in certain patients, we perform a special procedure called radiofrequency ablation. This is a treatment for Barrett's esophagus that actually helps to prevent cancer from forming down the road. If you or a loved one is suffering from GERD or Barrett's esophagus, please reach out to your primary care physician to consider setting up a consultation with a gastroenterologist.